Hello, my name is Jasmine McCorvey, and our group, which includes myself, Jasmine McCorvey, Desiree Utsley, Emily Rutledge, and Madeline Tepperberg, will be presenting to you today a quantitative critique based on the review of drug utilization patterns in NICUs worldwide. Take a seat, sit back, relax, and enjoy the presentation. Background. The study was done due to the high vulnerability of neonates, the high amount of medications being administered, and the correlation to medication errors. There was very limited data on this subject, and the researchers wanted to add more information to this study. There was a clear explanation of the purpose of the study. The purpose of this study was to look into medication use globally in the neonatal intensive care units, abbreviated NICUs, to detect any weak areas as far as medication management that needs to be addressed. There was no unusual events or conflicts of interest that occurred. The only problem endured was the irrational prescribing that was conducted in an Italian NICU. All right, next we're going to talk about the introduction. Yes, the introduction does grab my interest. I have a passion for the neonatal intensive care unit, and minimization of any type of medication errors is very imperative, not only for nursing, but for everyone involved with that particular patient. Neonates, just as the elderly, are a vulnerable population to medication errors. These little tiny creatures are born into this world with so many things going on. Their bodies are not mature enough to endure it all, and sometimes not even strong enough to manage the medication regimens needed to fix the problem due to their immature organ status. And when I say their immature organ status, I mean these babies are born premature, so their lungs may not be to full maturity, their liver and even their kidneys may not be to the full capacity to endure and process these hard medications that are needed for their bodies. So the purpose of the research was to add to limited research and give insight to the medications used in the NICU worldwide and determine areas needing more attention on the pharmaceutical aspect of care. The problem is that there is not enough information or research being done on such a vulnerable population, specifically neonates, that is identifying the misuse or current medication management for such errors seen in this specific population. There seems to be a lot of critical medications being used that, if used improperly, could really cause some damage to these neonates. And prevention of medication errors needs to be addressed, or even how they are being addressed, so that we can better adapt and improve that quality of medication errors and reduce that percentage of medication errors being done.
Next, we're going to talk about data collection. The data collection method used was a quasi-systematic review. This means that it is a review that includes qualities of a systematic review, but not enough to fulfill the criteria it would need for comprehensiveness. The authors chose articles that focus on drug utilization and prescribing patterns in the NICU. They retrieved these articles from various search engines including Medline, Embase, Scopus, and Google Scholar, and modeled their framework by Prisma guidelines. From here, a comprehensive search was done to begin screening the literature. They started with titles, then went deeper into reading into abstracts, and finally full articles. For an article to be chosen, it had to include the following criteria: neonatal patients, drug utilization studies, providing information on drug use patterns, prescription patterns, or drug consumption. It had to be written in English. Articles would be excluded if they only focus on the use of one class of drug, such as opioids. The reason for this is that they wanted to compare the most commonly used medicines in the NICU using the 8-pinch high-risk medicines list. This list includes medications universally considered to be a high risk based off of the grave consequences of misuse. Okay, so now 8-pinch. 8-pinch is an acronym that stands for anti-infective, potassium and other electrolytes, insulin, narcotics such as opioids and other sedatives, chemotherapeutic agents, heparin, and anticoagulants. Okay, so now we're going to speak on the sample size. The sample size focused on a total of 19 articles, which included preterm babies, generally less than 37 weeks. The preterm babies used in the studies comprised of 40% to 85% of NICU patient groups. The mean gestational ages of patient groups range from 31 to 35 weeks, with male newborns comprising 43% to 62.5%. This article did not focus on participants, but on articles that related to drug utilization, most commonly used in NICUs worldwide. The article established that inappropriate prescribing is one of the errors that requires improvement to help minimize medication errors.
Major variable instruments used. The instrument used to measure variables was a flow sheet used to explicitly identify and narrow down relative information. This tool essentially served as a process of elimination. First, articles had to meet one of three criteria: neonatal patients, drug utilization studies, providing use on drug patterns, prescription patterns, or drug consumption, and it had to be written in the English language. They began by choosing literature by choosing articles based off the title. These articles were chosen online as well as found in libraries. They printed all articles off, then looked at the abstract. Here they eliminated journals if they focused on only one type of drug, such as opioids or antibiotics. The reason behind this is that if the study only focused on one drug being used, it would not look at all drugs used as a whole and assist in defining what medications are commonly used worldwide. They then moved on to reading the whole articles to harvest information that they needed. Once they had their top 20 used drugs, they wanted to compare this listing to the A-Pinch criteria. The A-Pinch criteria is an acronym for medications universally considered to be high risk based off of grave consequences of misuse. From here, the authors were able to create a graph that showed the 20 most used drugs in the NICU and highlighted that 45% of those drugs are included in an A-Pinch. It also identified that of those drugs, an acceptable and lower risk alternative was available. Each of these tools assisted in helping the authors seek the information that they were looking for, identify 20 most used drugs, and also quantified how many of those drugs fell into the high-risk category. Additionally, by comparing information in articles, they were able to identify which drugs were used most, which was antibiotics, the median number of medicines used for a NICU patient between 3 to 11, as well as patterns of use.
Data analysis. In order to get a better look at global medication use, researchers excluded articles that pertain to only a single class of drugs, example, antibiotics. The articles that were chosen were reviewed to compile a list of top 20 most used drugs in the NICU. A-Pinch criteria. In order to analyze the risks of the most commonly used medications in the NICU, the study utilized the A-Pinch high-risk medication list for comparison. Universally, A-Pinch drugs are considered to be high risk and can have severe consequences if misused. Literature review. This study was basically a review and analysis of other studies. The researchers based their review on 19 articles with a focus on the type of medication used in NICUs. They narrowed the information down using keywords including neonate, drug utilization, NICU, and prescription patterns, so they chose articles based on 4 different types of criteria. The information that the researchers wanted to study and implement in their article was focused primarily on the A-Pinch high-risk medications list and how they have the most severe consequences. Clinical practice meaning. In regards to clinical practice, the purpose of this study highlights the importance of attention to detail when concerning medication administration in the NICU. As the neonatal population is considered a vulnerable one, the healthcare team must work to provide pharmacological care that is as low risk as possible. The results of this study help to show the clinicians how often high-risk medications are used in NICU facilities around the world. Furthermore, the studies work to encourage the healthcare team to look deeper into the dynamics of various treatment regimens. For example, substitutes with lower risk of adverse effects.
Assumptions. Assumptions made by the author were based on promoting the rational use of medicines to achieve safe and positive patient outcomes. These included high antibiotic use. The authors recognized that there is a high usage of antibiotics, stating that infection is a big cause of morbidity and NICU. To use less antibiotics, there should be more of a push on prevention of infection. Incorrect prescribing. The authors recognized that medications that have more serious consequences if used incorrectly were being chosen over medications that do the same thing with less serious consequences. Polypharmacy. Neonates are often taking multiple medications, and there is an increased risk that they could be taking meds that either do the same thing or do not interact well with one another. As a result, the author suggests that a pharmacist should do rounds in NICUs to ensure that polypharmacy is not occurring, decreasing medication errors and ultimately death. Use of narrow therapeutic index. This study shows that 2 drugs are commonly used in the NICU that have narrow therapeutic index. This means that the levels could quickly become toxic in a neonate. As a result, the therapeutic levels should be closely monitored. High use of A-pinch meds. Of the 20 most commonly used meds in the NICU, 9 of them are A-pinch meds. These are the meds that, if used, have a greater likelihood of fatal consequences. As a result, it is extremely important that those administering meds in the NICU must take extra precautions to ensure that it's the right patient, right med, right dose. High use of off-label, unlicensed meds. The authors recognized by looking at all the articles that there is a lot of drugs being given in the NICU that have not been tested for neonate use. As a result, they gather that there is a need to license meds for more clinical trials to be performed to provide a source of reliable information in guiding the use of medications for neonates. Origin of dosing recommendations. In addition to high use of off-label, unlicensed meds, many of the meds being used are used at different dosing. Not all dosings are inside the recommended dosing range. As a result, there needs to be more information published on the dosing of drugs to form a robust evidence base to target guidelines. Lastly, the final assumption made by the author is that there is too much variable in the way medications are prescribed. Whether it be on paper or electronic, it needs to be uniform to decrease variability and confusion. Limitations. The author identified a limitation in data collection stating that all active medications and formulas used in NICUs are included in drug formularies prepared by a hospital therapeutic committee, acknowledging that for specific needs, other medications may be used that are not included in these formularies. They stated that these are not often published, and for the sake of research, they could only use what was published. Another limitation was the average number of medicines used per patient. Worldwide, this number ranged anywhere from 3 to 11. Thus, it couldn't be definitely stated that these findings of the review accurately depict practice in NICUs due to lack of information available. The author clearly states that the 19 articles used do not give thorough account of global usage of meds in the NICU. Conclusion. The study concluded that similar types of medicines are used in NICUs worldwide. Common ones include antibiotics, caffeine, and vitamins. Of the 20 most commonly used medicines, 9 were A-pinch, high-risk meds. Among these were fentanyl, morphine, and heparin. Researchers suggest that future studies implicate the use of more than just 19 studies, as they say it is not a substantial amount of data. There is a limited amount of published literature available. They also point out several areas of concern that warrant further investigation to improve rational use of medicines in the neonatal populations. This includes the high use of antibiotics and off-label and unlicensed medicines. The recommendations made sense and were appropriate due to an increased number of samples. A more thorough analysis can be provided to help accurately depict current practice in NICUs. Furthermore, further investigation into a rational use of neonatal medicines can help to decrease occurrences of medication errors. This concludes our presentation. Thank you.
This will conclude the video presentation for our quantitative critique. We thank you for listening and watching our video. We have included our reference from the article that we have discussed. If you have any questions, comments, or concerns, you can list them in the comments section of our YouTube video, and we will do our best to address those as soon as possible.